All right, Meredith, so we're live now. Welcome, everyone. It is right on noon. I'm just going to give, there's still, I can still see the number going up for attendees, so I'm going to give it a few minutes for people to sign on, and then we'll get started right away. Meredith, we were just talking before, so you're doing this, so thank you for doing this today, and you're doing this from the office. This is not a normal thing for you. You're working from home, is that what you were saying regularly, or what's happening at the offices these days?
Yeah, so I mean, public health is part of Niagara region, which is one of the largest employers in Niagara. We have over 3,000 staff, and a lot of people can't do their work from home, but very early on it was decided that anyone who could work effectively remotely should work from home, just to keep the people who are here safe and allow them to spread out kind of throughout the building to create more physical space. So yes, the entire public health comms team, we've been working from home. We come in every once in a while to, you know, shoot a town hall video with our medical officer of health or attend one-off meetings. But yeah, we've been working from home for several weeks.
Okay. So let me just do a quick introduction of you. The attendee list is still going up, but we'll people can catch up afterwards with us. So welcome to Meredith, who I've known with quite a long time, and did briefly work at Leger, but we won't talk about that. And then she launched her public health career. So I'm glad that she's off and working in the Niagara region. So she's a communication professional. She has 15 plus years of progressive public relations, crisis communications, and event management experience. She's currently the manager of communications and engagement at Niagara Region Public Health. And I like the end of your bio where you reminded everyone to wash their hands. And for those of you who have been receiving or seeing Leger's weekly COVID surveys, you will know that we actually track the percentage of Canadians who say they regularly wash their hands nowadays. And it's at a pretty good number. If you do not see the COVID numbers and you're curious, I'm not going to tell you the number, but if you're curious at the hand washing behavior of Canadians, feel free to go to leger360.com. You can register to receive weekly updates for our COVID survey. I think we're on about 10 or 11 waves now. Basically, throughout the entire COVID experience, we felt like, what can we do to give back to Canadians and Americans and people that we work with. So we started doing a weekly survey, tracking behaviors, tracking attitudes, tracking fears, tracking what should we be doing now when it starts coming out of this. And then different changes. Last week we looked at some views people may have in terms of conspiracy theories. This week we looked at and Meredith, you'll be sad to know that just under 10% of Canadians believe the conspiracy theory that COVID doesn't really exist. So there's that out there as well, unfortunately. And then this week we started looking at who do you want leading you through it. We've always measured attitudes towards municipal, provincial, and federal officials. And in Canada, we've had a pretty good response to the various levels of government. This week's more fun question was, would you rather have Justin Trudeau or Donald Trump leading you through this? And we asked that to Americans and to Canadians and got some very interesting responses out of both groups. There are a group of people out there in Canada who would prefer Trump to be leading us, a very small group, but they do exist. And there's a pretty big group of Americans who would like to have Justin Trudeau leading them as well. So it's been fun. So please feel free to download that and take a look at that. Today we're going to talk about what Meredith and her team have been doing and what the world of public health overall has been involved with. And it's just a general question to get you started, Meredith. In the last few months, what's it been like for public health communications and for you as a public health communicator? Have you slept?
Yeah, so that's a good starting point. So, you know, just to kind of set the context, in Ontario, there's 34 different public health units. And each one of those health units, at least most of them, have a few communicators. So there really aren't a lot of public health communicators just in general, but we're a pretty close-knit group and we work, you know, really closely together. So You know, the fact that you said that up to 10% of Canadians don't even, well, that you surveyed, don't even believe that COVID is real, really highlights the importance for public health to be getting out effective, good information, because we know that there's a lot of information out there that is incorrect, a lot of conspiracies, and there's a lot of noise. So we think back to, you know, the last pandemic, which would have been H1N1, you know, social media wasn't around as much, right? So we know that we need to be cutting through all of that noise and get out information. So if we kind of phase it out, you know, I was looking back through my emails. The first email that I got about this strange new kind of pneumonia in China was, I think, January 4th. So we had been looking at this for several weeks. And then by the end of January, we had already, you know, activated, we'd gone into IMS, you know, the incident management system. We partially activated our EOC. So for several weeks before we even had our first case, which was on March 13th, we had already been meeting and going through a routine kind of reporting cycle, gathering information. But really it was, if we can think back to Wednesday, March 11th, when the NBA canceled and Tom Hanks got sick. And kind of from that point on, everything really blew up. So there, you know, we had those first weeks in March where, and it seems so long ago, that we were seeing cases around Ontario and in Niagara, but everything was still open. I mean, the Ford government didn't really close down non-essential businesses, I think, until March 23rd. So for that first several weeks, it was definitely extremely intense for public health communications folks who, again, we're supporting, trying to get the message out, but also supporting our internal teams while we ramped up a call center. So yes, very intense, but I think once all of the businesses sort of closed, the work kind of leveled off, and there were a few moments of lull, which got us very worried. And then there's been, you know, spikes throughout.
Spikes, so spikes of what? Spikes of cases or spikes of here?
No, a new kind of crisis that emerges, right? So initially it was, you know, the cases in Niagara that were all travel related, and you're sending out a media release for each initial case, right? Then it was, well, now we have community transmission, because we were all waiting for when are we going to have community transmission. So once we saw the first cases where they weren't travel related, that meant it was in our community. So a lot of intense scrutiny and a lot of media and communications around that. Then it went to long-term care homes and retirement homes. So, you know, a real intensity around that. And what we're dealing with, unfortunately, this week in Niagara, and it's, you know, happening across Ontario, is a lot of farm workers have been getting sick. So we have one local farm now that has, I think, around 40 cases, 40 or 60 cases associated with it. Don't quote me on that. But so now we're seeing a lot of media flurry the last few days around that.
Okay, so is a lot of your work reactive then? So something happens and now I have to get there, or are you proactively prepared for this? Like, did you have a set of releases and communications prepared for agricultural sector? Not hoping it, not expecting it to happen, but just in case. Like, how well is the preparedness plan for this? So
we're fortunate in Niagara that we haven't been the first for anything, right? So we have, unfortunately, we've benefited from areas like Toronto or Peel that, like Peel, for instance, when they had their, I think it was their first case, they shot a quick video with their medical officer of health. So we kind of kept that in mind, thinking, okay, when we have our first case, we'll do a media release, but this is a big deal. We'll shoot a short little video with Dr. Hergy and get that out the door. When it comes to the farms, Southwestern Ontario has been dealing with that for a couple of weeks, so we're able to see, you know, how they have been dealing with it. But what we're seeing is, because we have these 34 different health units across the province, each one, they're tailoring their message to their community and handling their communications a little different, where in some areas they're, you know, choosing, if I think back to long-term care homes or retirement homes, they're choosing to disclose the number of cases in each particular care home. Whereas in Niagara, we have, you know, at the heart of everything is it's personal health information, and we want to protect that. It's private, right? So when it comes to cases at a long-term care home, we're kind of deferring to the long-term care home or the retirement home that it's an independent business and they can speak to the situation in their own long-term care home. We're choosing to not disclose the businesses by and large.
Makes sense. And you talk about there's not a lot of you doing this across the province, but are you regularly checking in with your with communications managers in other areas of the province? I know you're watching what's going on and learning and looking at how they're handling it, but do you have a regular check-in with them, or is it more informal?
Yeah, absolutely. Formal and informal. So right now, for several weeks, we've been having calls that are actually led by the Ministry of Health Communications that all the public health communicators can call into, and we can ask them questions. And then we just have, informal kind of email lists that we'll email around. It was especially helpful in the early days when there weren't the posters, the social media assets, those resources available, that we were all kind of creating our own because we didn't have anything yet from the feds or from the province. So each health unit was, creating their own. So we would email around and say, hey, do you have a poster or an infographic about face coverings? Yeah, can you send me the working files for that? So we're fortunate that we've forged those good relationships when times are good, so you can cash in those credits when you're in a pandemic and you may need a little assistance.
Okay, you talked about posters, infographics, media releases. What's working best for you during this? Like, what sort of tactics? So if you need to tell me to do something, what's the best approach to telling me to do it right now?
Yeah, it's hitting all of those channels. We know that in Niagara, print media is still extremely important. Since day one, our medical officer of health has done a daily interview with our local dailies. So whatever the key messages of the day, he's delivering it, doing an interview with one of our local reporters. It's getting printed. We are tweeting that. We also, because we're part of a regional government, we run our own social media in public health, but then we also have regional social media. And so, they tack into that. We also have communicators from our 12 local tier municipalities that we work very closely with, and they kind of amplify our message. As well as billboards. We've been doing billboards, things like, public health has a number of programs and services. Billboards that had already been booked months in advance for, smoke-free beaches or something like that, we were able to pivot and get our public health messaging up there. And then finally, LinkedIn is a new channel for us. So we started it at the beginning of the year, and it's really, really grown through COVID. So on a bit of a tangent, if I say to you, I do communications at a hospital, you know what that means, or a municipal communicator, you know what that means. But we know that public health, a lot of people don't really know what public health is. They may have been to a breastfeeding clinic or got a note home that their child's vaccinations weren't up to date for school. But if you think kind of overnight, public health was thrust to the forefront, and if you wanted to get a COVID test or you had questions, you had to be calling public health. And we know that a lot of people didn't really have a relationship with us. How we're using LinkedIn is we're creating these staff profiles of people who work in public health, who are supporting the cause, and we're posting them to LinkedIn so people can learn more about them. Because you've probably heard the term epidemiologist the last few months. You may have never heard it before, and you may have thought it had to do with skin. I know I did when I started public health. So we're featuring these different types of public health roles on LinkedIn, and then sending them out through our different channels, and people are really liking it. They're learning a lot about us.
So that whole bit about building relationships with community and with people, and I think that's fantastic that you're doing that. Will you continue that after this, do you think? Is that part of the new challenge for you, is to build those relationships up?
Absolutely, because while the COVID response is going on, we still have a number of programs and services that public health offers, and they're planning on how they're going to deliver those programs and services in the new normal, right? Think about breastfeeding clinics or, our sexual health clinics, all of those programs that we may need to adapt. And so we want to build our relationships with the community during COVID, hope it's a good relationship and they've had a good experience, and then maybe capitalize on that in the post-COVID world and remind people of our other programs and services.
Okay, so I always like to, every once in a while, have a conversation with you about this time of year is your infamous tick season in the Niagara region, and all the work you do around ticks, and you talk about breastfeeding, you talk about the other programs you have in place, but I don't know, ticks just kind of resonates for some reason. Are you able to continue those other programs? And because ticks still exist, people still need to breastfeed, sexual health still needs to be talked about. How are you fitting all of that in and answering everything with COVID?
Yeah, it's a real challenge, right? Because especially now, a lot of people are outside. So maybe in the past you wouldn't have been on as many walks in a forest, but you're doing more of that now, right? So unfortunately, with the public health offices being closed, people can't be dropping off a tick to have it identified. But what we're doing is if people are emailing us or calling us with questions, we can connect them with a public health inspector. They can send a picture. They can, I think it's something called etick.ca. There's actually a website where you can go and look and have your tick identified. One of the nice things about fewer cars on the road and less traffic, we're seeing a lot more animals out in the wild. Well, that has led to an increase in interactions with animals. So we've actually had to up our messaging about please don't pet raccoons. They're not your friends. They may scratch or bite you, and that there's a risk for rabies. So we do have to pepper in the public health messaging, but with a bit of a COVID spin.
Okay. So let's go back to COVID. You and I were talking the other day about the Andre Picard article a few weekends back, where he talked about, and I don't know, he talked about it in a great way. He talked about basically if you're going to talk to teens, you can't say don't have sex, but you can give them methods to do safer sex. Under COVID, a lot of our message has been don't do this, don't see, but is that the right approach going forward? Are we starting to get tired of the don't do, and is it more of a harm reduction message that needs to go forward? What's your approach to this?
Yeah, I mean, and I loved that article because it was the old-fashioned public health harm reduction approach, right? And I think the questions, I think maybe he wrote that article because we were talking about, you could have a cleaning lady into your home now, but you can't have Nana over, right? And so that's been a real challenge for people. And even now, I mean, I was chatting with my husband about this, that I think massage therapists, are back up and running, but I can't get my hair cut. And so it's like, how are we differentiating, right? So you're right. I think, we're all hoping that there's going to be a vaccine soon and that we can jump to the mass immunization plan that public health will be delivering. But for now, it's really about those old-fashioned harm reduction methods, and physical distancing works. Hand washing hurts, works. Or, wear a mask out in public if you're on transit and physical distancing can't happen. So we can't, I mean, this is my opinion, we can't keep our businesses closed forever. So we need to be creative and think about how we can reopen the economy and work in those harm reduction measures.
Okay, and you've given me a nice segue to talk about next week. We're going to have Dr. Noni McDonald on, who works at Dalhousie University and specializes in vaccines, communications, and vaccine hesitancy, like why some people don't vaccinate, and how when we start to communicate and talk about this, how complicated the message of vaccine will be. So thank you for saying vaccines, because it gives me a chance to say that for next week. And hopefully everyone who's signed on will sign up for next week's as well. In terms of questions, if anyone signed on and wants to ask a question, there is a questions tab just to the right of your screen. Please feel free to ask it. And as long as we have time, I will pass those questions on to Meredith while we go through. So is there anything I guess what's the did you have some, let's start right back to the beginning, before January 4th. You had a pandemic plan, I hope, in terms of if this happens, this is what we're going to do.
Yes and no. I mean, I don't think anyone could have predicted this. Like, could you imagine, even if I said this to you on March 1st, that by the end of the month, you wouldn't be leaving your house? I mean, it was I don't think I could have pictured that. But what we do have, I mean, we had plans for, we had a measles outbreak a couple years ago, and that was very intense for several weeks. And it was, so for me, the kind of closest thing we've come to was that outbreak. A lot of our plans, our business continuity plans, really revolved around a labor disruption. So what would happen if, so I think we were, a couple of years ago, there was the potential that unfortunately our nurses would have gone on strike. So, our most recent plan was about how would we function during that and the communications around it. Or I think even a mass immunization plan. So what does that look like? Nothing, really nothing like this. And even by the end of January, I'd met with my colleague who is in communications at the local hospital system. And we sat down over the course of an afternoon and worked on our plan. So what's going to happen when we have our first case in Niagara, joint media release, and we're going to have a press conference. And, so we did have a plan, but it didn't play out like we thought it was going to. But you have to be flexible. You can't be rigid. And, for us, when we had our first case, it had already been leaked to the media. And we couldn't even issue our media release because for the first several weeks, there was a protocol in place where the province had to update their website with case numbers and details before the local health units could follow suit. And so by 10 in the morning, the media knew we had a case and we couldn't do anything about it. So you just, tomorrow's another day. We'll try better next time.
All right, so from that, after this is all finished, and actually one of the things that we've been hearing through these sessions is people are talking about chronicling. So someone's been keeping track of what's been happening and what's worked and what hasn't worked while they've gone through this. I don't know if you're doing that or not, but the goal is eventually to come back afterwards and reassess and be prepared for the next time. Is there certain lessons that you've already learned that you'd like to share, like things that have worked well for you?
Yeah, so I think we are kind of chronicling as we go along. And what's going to be important after this is to really kind of chunk that out in different phases, right? I think in terms of lessons learned, this is more of a sectoral thing than us locally in Niagara. It would be great if we were better coordinated as a province, as a system of health units across Ontario. But again, I mean, things were happening so quickly. Even 2 or 3 times in a day, policies would change, guidelines would change, information would change. And we also have to remember too, you think of something like cancer. How long have we known about cancer? A really long time. And we're still discovering new things about cancer. We've known about COVID since like mid-December. And so it is a brand new disease that we're still learning about every single day. So it's hard to look back and think, oh man, I wish we had done this differently. We don't know. But what's important to remember too is everything is done with the best of intentions. And we're always trying to think of what do we need our public to know, knowing that they're getting a ton of information from everywhere. What action do we want them to take? What is in their best interest to know about? Because there's a ton of data that we could be sharing, but really, what do they really need to know?
Okay. How are you tracking sort of public perceptions or sentiment or awareness? Is it through looking what the information they're receiving, or do you have some way to touch point with your community and talk to them? How are you collecting that type of information?
Yeah, so a couple of ways. we meet weekly with our local tier municipality communicators. So it's great to hear their perspective, because to most people, if you live in like St. Catharines, you have a relationship with St. Catharines. So you may be calling St. Catharines or tweeting at St. Catharines. So we're kind of gathering information that way from our 12 local tier municipalities. But also, anytime someone submits a question through our website, I get CC'd on that. So I'm seeing the type of questions that are coming in. I'm also seeing what the conversation is on Twitter. I'm hearing about what are people calling the nurses to talk about. We also have live chat. So I'm hearing about what are people talking about on live chat. We're taking all that information and thinking, okay, you know what, we actually have a gap around masks. People have a ton of questions about masks. Very early on, it was when everything was kind of shut down, the number of questions we were getting about, can I go fishing? Can I go for a walk around the block? Okay, so clearly there's a gap here that we're not being clear with people about, you know, what they can be doing. So we update our website. We have this great FAQ on our website. We're tweeting about that. We'll shoot a quick video with Dr. Hergy and send that out. We'll give social media assets and key messages to our local tier municipality communicators so they can get the message out. So we have a constant feedback loop that we're hearing from the public. We're taking that information and figuring out, you know, okay, what do we need to communicate more about? And then it's going back out.
Oh, that's fantastic. Okay. We have a question from Christian from Quebec for you. We've had issues here in Quebec with the fact that no illness or condition is more important than another. So, for example, autistic children should not be set aside to give priority to COVID-19 afflicted patients. So this gets back to how do you manage all the different conditions that public health falls under or becomes responsible for. So from a communications perspective, yes, COVID is very important, but how do you make sure people who have autism are still being given the information they require or the resources they require or where they go? Or how do you make sure, and this gets back to the breastfeeding conversation, how do you make sure everyone is still getting the level of information and communication they need?
Yeah, I mean, it's very difficult. We have community partners that work with certain audiences too, right? So we're trying to support them. One of our medical officers of health, our associate medical officer of health, is the liaison officer as part of the EOC. We love our acronyms. She's working very closely with community agencies that support different groups, right? So that we can make sure that they're getting what they need and they can still support their publics. We also, part of our team, we have the physician recruiter for Niagara, as well as an engagement consultant who works directly with the primary care audience. We know that people aren't calling their doctor because they may think that their doctor is closed, or they're not even aware that they could be getting, you know, a virtual appointment. So we're trying to get that messaging out too, because we're very worried that people aren't going to the hospital until they're very, very sick, or they're not, you know, calling their doctor. So it's very difficult to be kind of mixing in those messages as well.
So, you know what, I should have just paid you a whole bunch of money to lead me into a whole bunch of discussions. So it gives me a chance. One of the things that we did at Leger, so we have our weekly COVID survey, but we also have a few syndicated surveys that we put out. And one of it is on the future of healthcare during COVID and after. And we're tracking people's move towards telehealth. You know, how are you interacting with your doctor? And we looked at people with chronic conditions across Canada. And it's also yes, I'm not talking to my doctor as much as I did, and at least not in person, but I'm also changing my medication. I'm reducing, I'm saving because in case I might run out. So there's been a whole bunch of behaviors that could affect us down the road. And that leads to our next question from Patrick, who actually lives in the Niagara region as well. He's talking about there's a good chunk of Niagara's population is older. So when you're dealing with older people, how has that affected the adoption or use of telemedicine, or even in terms of how you're communicating? You know, what's happening with this older population when it comes to interacting with physicians and sort of the future of this in your region?
Yeah, Niagara is definitely an older population. And so from a communication standpoint, from the get-go, when I talked about how important print is, because we know that a lot of older folks are reading the paper, right? But we also know that they may be speaking to their children or grandchildren. So hopefully, our digital messaging is getting across and being, fed up to the older population. But yeah, it's difficult. We also have areas of Niagara where internet service isn't great. Some people don't have computers. But I think before COVID had happened, we were kind of moving into a direction. So EMS, the paramedic service in Niagara, is part of public health, where they had launched a community paramedicine program because some of our communities either don't have primary care in them. They may not even have pharmacies there. So we have this program where a paramedic, is working in the community with these folks who maybe don't have access to transit or maybe don't have a car and can't get to a doctor in a city. So I think we're going to see, we call it mobile integrated health. I think we're going to see a lot more of that. Definitely with telemedicine as well. I'm pretty sure, so we have a community mental health program as part of public health. I'm pretty sure that they already have the telemedicine in place. But yeah, what are those other ways? Like we have tobacco cessation programs where people would maybe come to a seminar to learn about quitting smoking. Can we deliver those virtually? We started out the beginning of the year, maybe even before that, as a pilot project to have online chat with a nurse in our parenting program. Well, overnight with COVID, we really blew that up. And so now you can chat with a nurse almost about anything online. So it's actually been an opportunity for us because where there may have been barriers in the past to do this virtual kind of service, now we're stuck with it. We may have to just move in this direction moving forward. Yeah.
And that's what we're seeing across a number of industries and sectors, is that everything that we were thinking about in maybe 5 to 10 years is happening now. It's just like just fast forwarded to right now. And in the good news, we're ready to go. I mean, you talked about getting your call centers up and running. I mean, that's in-house, but one of the things that we found at Leger's, we have, I think we had 250 in-house call center staff on a regular basis. Within 3 days, we had 180 of them working out of their own homes. We never thought we'd be able to do that. How have you handled let's talk internal staff for a second. How have you handled your call center and how are you communicating with internal staff throughout this?
Sure. So yeah, I mean, if I think of, public health, we have a number of programs. So we have lots of nurses, but they all work in different programs. And again, almost overnight, we needed to scale up to have this call center, which means shifting nurses away from a different program, training them up, right? Because you may have been, a breastfeeding nurse and you're not really experienced in infectious disease or contact tracing. So, and then from a tech standpoint, we couldn't do this remotely. They have to be in-house. So that was another reason why if you could work from home, you were asked to work from home because again, we needed to, spread out the nurses throughout the building. So we're fortunate to have one of my colleagues, Andy, in logistics, who kind of overnight made it happen because we had hundreds and hundreds of calls in a single day. And then with the online chat, again, we already had it kind of a little bit, but it was a matter of reaching out to the vendor and saying, okay, we need this many more licenses, we need them right away. And we just made it work. In terms of internal communications, so again, Niagara Region, large organization. For the first month or so, COVID was kind of limited to public health, and it was more of public health interest because it hadn't impacted our community or our other staff. So we'd been doing, our medical officer of health sends out a Monday email every week, and he provided some updates, and we partially activated our EOC. But then once it kind of shifted to, no, this is affecting everyone in Niagara, including our staff, we just kind of pivoted those internal channels we already had and started offering them to all staff. So we started hosting these Skype town hall sessions where I would interview Dr. Hergy as well as Ron, our acting CAO. Staff could submit any questions that they had. It was live and we would read out the questions and they would be answering them. we've since turned that into a pre-recorded session because we kind of overwhelmed the system and it was freezing. So many people were logging on, which is great. So now people submit questions in advance. We also, as part of our community services department, we operate long-term care homes in Niagara. We have several under our operation. And so those staff have a very specific set of questions, a set of needs. So Dr. Hergy and I filmed a little town hall just for those staff to log into. So we're trying to segment the different populations and target our messaging to them.
Okay, I have a really long question from Ryan Prasad from out in BC. So bear with me, I'm going to read this through. And I know Ryan from past as well. Thank you, Ryan, for the long question. So Meredith, thanks so much for your point of view, and thank you for all the work you're doing to ensure the community is informed as possible. BC is moving into phase 3 of our 4-phase restart program. I recognize we're in different jurisdictions, but we're learning a lot from British Columbia's public opinion quant research as well as digital qual, so from the government standpoint. We are learning that there seems to be an enhanced trust towards government communication coming from provincial and federal levels. How are you ensuring consistency and synergies around the communications you are sending out to your community and what the province, federal government are communicating? So how is Niagara making sure it's consistent with what the province is saying, or does it have to be consistent? I don't know, and with what the federal government is saying?
Yeah, so it does have to be consistent because a lot of what's coming out from the feds or from the province are actual, legislated stuff, right? So it's guidelines, it's policies that are sort of enforced at a local level. So where there's been a few issues is maybe there's been a provincial announcement about something, but we don't have the information in our hands yet. So it'll be at a press conference. So if I think back to a few weeks ago where, in the provincial announcement was about, anyone can get a test, walk-in test. You can just walk in and get a test. Well, locally, we weren't really set up for that. So our assessment centers were still requiring an appointment. And you'd call public health and we'd get you an appointment, or you'd call your doctor. So for a few days, it was challenging because people were just showing up at the assessment center. They weren't being turned away. And, the hospital sent out a message saying, that's cool, you can show up. You may have to wait though, and we would prefer that you call and book an appointment. So there's been a few instances where there's been a lag, where something is announced and we have to, run with it locally, but we don't have all the information yet. But luckily, our medical officer team are very connected to the province and they're on calls every single day. So it's rare that we are surprised with anything. We may know something's coming. But to answer the original question, yes, we need to make sure that we are in alignment with whatever the feds and the province are coming out with. And luckily, they're in alignment, right? Because that would be difficult if they weren't.
So what's the next steps as we come through this? What's next for your team, or what are you starting to think about and plan, without giving anything away, but what are you starting to plan for down the road?
Mm-hmm. So I think really we're thinking about when the next phase of reopenings happen, how can we support our business communities? How can we support our municipalities, right? Because the businesses, their first call is to their local mayor or their local community. So how can we make sure that we have the information available for them? Public health, our inspectors are working behind the scenes trying to support our local stakeholders for if and when they do reopen. So I think, there's that next phase. Also reminding people that we're not in the clear just because perhaps, great, the patios are open. Well, you still need to maintain some physical distance. You still got to wash your hands. So people are really going to be sick of hearing that, but it works and it's important. Yeah.
But you're starting to see, a general relaxing of the way people are moving, giving space, or
Yeah.
standing in line. As it's opening, you are starting to see a little, makes me nervous. We are starting to see people together more and getting closer to people. And that's one of the things we measured in our surveys. Are you having a hard time maintaining 6 feet distance? And that's been changing over time. So,
Yeah.
so you're right. You have to make sure people, it's that constant reminder, I guess, going forward.
Yeah, and as we get into the summer, I mean, at a certain point, the beaches potentially will reopen. Niagara has a ton of beaches along Lake Erie, along Lake Ontario. So how can we support our municipalities with that? And, you know, our worry too with, you know, with face masks, you still, you know, it doesn't mean it's not 100% thing. People think it's a safety net. Well, I've got a face mask so I can be out in a crowd and not maintain physical distance. I mean, it's something and it helps, but it's not 100%. So, you know, we're gonna need to be keeping that up as we reopen the economy. And also, again, in the background, we're already planning for mass immunization. We have a team working on, okay, what are the best locations in Niagara for when we need to deliver a vaccine to potentially 450,000 people? Where are those buildings? What does staffing look like? What does communication look like? We're already working on that. And then the other business continuity stuff about delivering, you know, a breastfeeding clinic online. What does that look like? A whole bunch.
Yeah, a whole bunch of stuff to go forward. Well, listen, we're coming up to the end here. I don't like to keep people too long on this. We've promised them a half hour plus. We're at 40. So thank you very much for this. And thank you for everything your team and you have been doing throughout this. Very much appreciated. Thank you for everyone who logged in today and for the questions. And please sign up for next week when we have Dr. McDonald talking about vaccine hesitancy and how to communicate around that, so that when Meredith's team has those vaccine centers, immunization centers set up, that people will actually go to them and participate in the vaccine program. Anyways, thank you very much, Meredith. Have a great day.
Wash your hands.
Bye, everyone. Yeah, okay.